Ministerial Advisory Committee on COVID-19 discussing the possibility of mandatory vaccines for specific groups of people. Is this discussion going on? This, as scientists and health activists are saying that compulsory vaccination for healthcare workers and other professionals who spend time indoors with other people may be necessary. Well, let's speak to Professor Barry Schoub now. He is the chairperson of the IMC on vaccines. Prof, a very good morning to you. Thank you very much for your patience amid these phone lines today that are playing up. Firstly, let's just get your sense about whether this issue of mandatory vaccines is indeed under discussion. The Sunday Times report yesterday quoting the Health Ministry spokesperson, Popo Maja, who was saying that, and I quote, compulsory vaccination is not on the table for discussion. But you have been quoted directly contradicting that, saying that this is being discussed. So what is the final word on this?
Good morning, Xoli. Thanks for having me. Look, it's not a contradiction. Our Ministerial Advisory Committee is not part of the government. I must emphasize. We're an independent body of scientists who look at various aspects, and then we provide the advice to the minister. Of course, the minister is at liberty to implement or not implement. The vast majority of what we have advised, I should say, has been implemented. There are one or two exceptions which haven't. But the point is this: that it's in the Department of Health itself, as Popo mentioned, it isn't a part of the discussions. Within our MAC, our Ministerial Advisory Committee, it is. We haven't yet given any kind of advice. We haven't yet given any kind of suggestion or proposal. It's just something which is on our agenda. It is being discussed. Yeah.
Why is it important, Prof, that it be on the agenda, at least of the IMC, which you lead?
It's not actually the IMC, it's the Ministerial Advisory Committee. The IMC is a separate body within the Department of Health.
Sorry,
it is important, it is important because it is an aspect which needs to be looked at, and all the various issues relating to it need to be examined before one can really give an evidence-based or a rational suggestion or advice. So amongst many other things which are on our agenda, from scientific matters to things like mandatory vaccination, do come up for discussion. And it is in that background where I mentioned that it is part of the agenda.
Yeah. Some scientists then, Prof, who I suppose agree with you and the team that you lead that mandatory vaccines ought to be undertaken for specific groups of people. There are also health activists alike who are agreeing and saying that the rights of an individual versus the issue of public interest in the face of a dangerous virus that is also airborne, surely individual rights must be trumped by those of public interest. Is that the same view that you carry?
I think that's a very important view. There have been various kind of viewpoints on both sides. But you know, we've had mandatory vaccination for example, hepatitis. All our medical students have to be immunized against hepatitis, and there's never really been any discussion around it. It has been accepted that if you're a healthcare worker, you need to be protected. You see, I think in any contagious disease, the kind of I guess the fundamental reason for compulsory vaccination is that it's not only individual protection, you're also protecting the people that you come into contact with. And I think that's really the kind of motivation behind it. And this is why an infectious disease has got a different kind of concept, a different kind of logic to any other kind of imposition, even a healthcare imposition, because this is not only individual, it's community as well, or people that you come into contact with.
Yeah.
Yeah.
Prof, then, of course, many are going to talk about the Constitution, and they're going to put it up and say it is the Bible, so to speak. And so individuals' rights, the right to bodily integrity is supreme.
Correct.
How is this going to be navigated then?
Yeah, I think that's absolutely correct. I think it is enshrined in our Constitution that bodily integrity is a right. It's a fundamental right. But then you see, I think the way that it's navigated, it's the bodily integrity not only of the individual who's vaccinated, but also the bodily integrity of the people that that individual comes into contact with. I think that's where an infectious disease has a difference, because the problem is that there are consequences. There are consequences to vaccination. It's not just the person, they're not just the individual.
Last question to you, Prof. Then we hear that the grouping that at least becomes very important right now is that of healthcare workers. What other groups do you foresee that, should this, come to pass, that mandatory vaccines are insisted upon in certain sectors? Which other sectors might there be?
Yeah, Corey, I think if you really take the one extreme, maybe even more than the healthcare workers, are people who look after people in aged homes, homes for the intellectually challenged, who may be immunocompromised, all those care workers, because they are really intimately coming into contact with people that are really vulnerable to the more serious effects of COVID infection. I think very, very few people would kind of have any objection to a mandatory requirement for those staff, for those personnel to be vaccinated.
Yeah. Finally, Prof, I'm letting you go, I promise. How aggressively, do you plan to push this through, particularly to the ministry which you advise?
Yeah, let me take one step, Gordon. We haven't really, as I mentioned before, made any recommendation. We haven't really come to any conclusion.
Yeah.
This has just been discussed. And it's been discussed fairly widely with various opinion formers and so on to come to some kind of recommendation. But let me stress, there's no recommendation as yet.
All right. Professor Barry Schoub, always a pleasure talking to you. Thank you very much for your time. He leads the Interministerial Advisory Committee on Vaccines.